Everyone Counts describes a new process of NHS planning for the new NHS that comes into existence on the 1st of April 2013. Planning in the NHS is about how we and clinical commissioners work together to deliver improved outcomes for the patients of England and ensure that they benefit from the rights outlined in the NHS Constitution. But a new NHS, one that is built on assumed liberty, with clinical commissioning groups having the main responsibility for looking after their local populations on behalf of the NHS, requires a different approach to planning than we've had in the past. What Everyone Counts does is set that out. The new approach to planning has been worked following discussions with the people who will be delivering it in future. What I've heard is a big interest in ensuring that within the NHS planning system we carve out a real focus on the needs of local communities, as well as reflecting on the national ask that comes from being part of a national health service. To meet that very legitimate challenge that I've heard from clinical commissioning groups in particular, we've now broken the planning process down into three lenses, three different kinds of plans that taken together give the offer to patients about what the NHS will do for them next year. The first lens responds to that message from clinical commissioning groups that they want the space to work to focus on the needs of their local communities. We want the NHS across the country to improve against the NHS outcomes framework because we know those are the things that make a difference for patients. But we know the needs of local communities are different, and that's what we've heard from clinical commissioning groups. So we're asking every part of the country to look at its local needs, working as part of local health and wellbeing boards, and come up with a plan that makes an improvement in outcomes for that population. This is a different kind of planning ask than the usual national planning ask. We recognise that that needs to be led by clinical commissioning groups, working with local authorities and colleagues in health and wellbeing boards. Our offer from the NHS Commissioning Board is that we, as a fellow commissioner, will be in those conversations as a member of local health and wellbeing boards, contributing to the discussions on the needs of local communities. But what we won't be doing is predetermining the outcome or performance managing the outcome of that. This is about local collective analysis of what's needed, the local ideas of clinicians who are in touch with local population needs, coming up with a plan that works for those local areas and holding themselves to account in the local area for making those improvements. That's a new approach to planning, one that's really important, and we're determined to give that the space and the resource and, from our point of view, the information support to help it happen. But it's not one we manage in a top-down way. At the same time, there are two other very important lenses that come together to give us confidence that we're doing right by patients. The second lens looks at the clinical commissioning group as an organisation and builds on the work that each clinical commissioning group has done to prepare its plans for next year that they have worked up as part of their authorisation and development process. So it is about asking a clinical commissioning group what its plans are to improve outcomes and to ensure that its patients benefit from the rights in the NHS Constitution. The third lens to planning turns the focus onto us as a commissioner, the NHS Commissioning Board. We commission across England around £26 billion worth of care for patients. We commission the care provided by general practitioners and other primary care practitioners, right through to the very specialist care that is provided to often very small groups of patients suffering from very rare conditions. And our offer is that we make a commitment to, over time, becoming an exemplary commissioner in our own right. And so the third lens is about our challenge to ourselves to be as good as we can be in using that resource to the benefits of patients. Taken together, those three lenses, the very local lens looking at local needs, the focus on the clinical commissioning group as an organisation and how it uses its budget to help achieve benefits for its patients, and the challenge to ourselves about becoming as good a commissioner as we can be to use our resource wisely. Taken together, that reflects a very new approach to planning, but one that I think has real benefits for patients. And that is what Everyone Counts is all about. Within Everyone Counts, there are some tools that we believe will help commissioners do their job in planning for the future. So I'd like to highlight just a couple of those very quickly. The first is an opportunity to reward excellence. Patches and organisations that go beyond the minimum on behalf of their patients. And I'd just very briefly like to highlight two examples of that. We have a commitment in the document to a quality premium for clinical commissioning groups. This will be, again, I think, reflecting the balance of national and local in the new system, not merely a list of things that we want to see from the national commissioning end, but a synthesis of a national ask around improvement in a small number of areas of the NHS outcomes framework, with a group of self-set improvement objectives based on local need, and that are agreed with the commissioning board but come from the clinical commissioning groups themselves. And across that basket of, some things in the national outcomes framework and some local relevant improvements, organisations that make improvements in 13-14 for their patients across that will be rewarded with a small quality premium in 14-15 to further invest in improving services for patients. On the provider side, we're once again putting around 2.5% of resource into a programme. There will be a national ask as part of that, as there has been in previous years. And this year we're looking to see improvement in 4 key areas, which I think are worth briefly highlighting. The first is an improvement in care for people with dementia. The second is the effective rollout of the Friends and Family test, ensuring that we ask patients what they thought of services and whether they'd recommend them. The third is the use of the NHS safety thermometer to ensure that our services for patients are even safer. And the fourth is an improvement in screening for patients for venous thromboembolism. So there'll be 4 measures there which we will look to see improvements in next year and will reward through Sequin. To get Sequin, of course, providers will need to have also met the high impact changes in the improving health and wealth strategy that we set out last year. So, in conclusion, Everyone Counts is a new approach to planning, one that is built on the structure of the new system and that recognises the important role of local, autonomous, clinical commissioning groups in driving change for patients. I very much hope that everybody reading the guidance will see the clear intent of the commissioning board to make the new system work, and will find the tools that we've outlined there and the support that we as a commissioning board are giving into local planning as a helpful part of preparing for the important work we have to do next year.